welcome to Viewpoints. With me today is Cherié Penn, Assistant Chief with the Minneapolis Fire Department. Welcome.
Thank you.
Now, you wrote a thesis on substance abuse in the fire service. Can you tell us more about that?
Certainly. There are alarming incidents that play out in front of the media where we have firefighters that are busted for unscrupulous behaviors. And working on my thesis and seeing these things play out and there being a matter of the public's trust wavering in the fire service, I thought that it was worthwhile to take on looking at how substance testing is conducted in the fire service. And so in doing that, I conducted a policy analysis of 12 fire departments across 12 career fire departments across the United States.
Can you tell me about some of the findings of your thesis?
Certainly. What I found was there were things that were universal amongst the 12 policies, things that were missing, things that were common amongst all the policies. But what was troubling was the terminology. And it's important in public safety that we are able to communicate. And with that communication being broken down, and I identified that in these policies, it was important for me to look for just a common way that the fire service could maybe implement and go about universally conducting substance testing of its firefighters. And in doing that, I found that the DOT has language already established that will allow fire departments to implement that, and that would entail all of us going to operating off of the same type of language in the through the Department of Transportation. And in using that language, it would then reduce the inhibitions as to whether one department is using one method of testing and another department is using quite a different method of testing their firefighters to detect substances in their system.
So there's really no standardized system across the country at this point?
There is no standardized system for testing firefighters.
Wow. I imagine that in researching 12 different policies from 12 different departments, there might be some findings that could be characterized as controversial. Was that the case?
That wasn't the case. What was the case was that I found that there were different regulatory sources of language that each of the departments were using. Some were using Department of Justice, some were using Department of Health and Human Services. And what that does is, if that's confusing from a policy analysis standpoint, then there has to be some aspect of confusion from the end user or the person that's supposed to be abiding by the policies. So it wasn't anything that was controversial, just concerning that we all speak the same language and we all operate off the same page, so that we all know that when we're converging in a response aspect, that we're all using the same language to possibly prevent, deter, detect, treat, and rehabilitate our firefighters using the same language.
Can you talk to me about some of what your recommendations were based on your research?
Certainly. The recommendations were that fire departments, over a period of time, realizing that change is hard within any organization, but over a period of time, migrate towards using the Department of Transportation's language to conduct substance testing amongst its firefighters. And what that would do is the Department of Transportation requires a certain percentage of firefighters or employees be tested on an annual basis. It tests for certain chemicals, certain compounds, and it sets the blood alcohol content of 0.04 that could be used and standardized across the fire service as well. So not only does it look at substance use, it looks at alcohol use as well.
That's great. Cherié, in our conversations over the last 18 months, I know that your thesis topic is very passionate to you and it's one you're very interested in. So I also have to imagine that in doing this research, there were things that you came across that perhaps you didn't have time to go into. If you had additional time, what are a couple of those things that you'd like to pursue or research in more depth?
My passion for the subject stems from the fact that I'm a consumer of the services that I provide. I'm a resident of the city of Minneapolis. Some of the things that frustrated me in doing this project was the fact that I could not talk to other agencies. I had to resist the temptation to call other agencies and representatives that were kind enough to provide their policies and supporting documentation to me. I couldn't pick up the phone and get that personal perspective. It would have been interesting to hear the biases, to hear whether their programs, their policy as far as substance abuse and use, and how they conduct their testing, if it worked well for their organizations. What was the percentage of times that they detected someone using substances? Did they consider it a problem? I could go on and on about the things that frustrated me about my thesis and my project, but overall, I think the end result is enough to build a foundation for further research.
That's excellent. Well, I appreciate you joining us today. And that's all the time we have. Thank you for joining us here on Viewpoints.